Anesthesia allows us to, comfortably ensure that you're asleep, not feeling pain, and having no sensation or awareness that you're having a surgical procedure. There's a lot that goes into it. It's more than just keeping you asleep. It's also maintaining normal vital signs, maintaining normal laboratory work, and thinking about things like your postoperative pain, your postoperative nausea, and other symptoms that you might have under anesthesia, and do the best we can to eliminate those. At its core, anesthesia is keeping you without sensation and awareness during a surgery.
General anesthesia is where we give you a medication that puts you completely off to sleep, where you are unconscious and unaware. The medications are typically given both IV and via a volatile anesthetic that is given to you either via a mask or there is a tube, it's called an ET tube, is placed in the back of your throat after you are off to sleep, and it allows us to secure your airway to prevent any type of aspiration.
Monitored anesthesia care, or what I like to call twilight or sedation, it's using medications, usually just through an IV, in order to get a patient asleep, unconscious, unaware of what's happening, but awake enough that they keep breathing on their own, they keep their natural airway open. And that allows patients to undergo procedures where we don't need full-blown general anesthesia, we don't need to take over their breathing, their airway. We can let their body do what it's meant to do on its own, but make sure that they're sleepy and comfortable for the procedure.
So regional anesthesia, as it implies, is the part of anesthesia where we're not using any sedation per se, but we are using a regional anesthetic technique, which is a local anesthetic that we inject and bathe the nerves supplying that part of your body. For example, for a shoulder surgery, we can go and bathe the nerves that supply the shoulder area, so your sensorium is all intact. You can hear us, you can talk to us, but your shoulder is numb temporarily for a few hours while the surgery is being performed.
So a peripheral nerve block is a sophisticated technique that allows us to deliver numbing medications directly to a nerve.
What that can do is numb up an entire limb, so that a procedure can happen, say, on your wrist, your arm, or even your leg. And this helps to reduce the sensation during the procedure of the surgery happening. And it also helps to treat with pain after the procedure's over.
So like anything in medicine, anesthesia is not risk-free. I oftentimes will say the risk of everything is 1 in something. Thankfully for us, the serious risks of anesthesia are very, very uncommon. Now, nobody is zero risk, and there are some serious risks from anesthesia, and your anesthesiologist will let you know whether or not your medical history and the surgery makes those a consideration for you. But the vast majority of patients proceed through surgery and anesthesia with no or very minimal complications.